The topic of the European Health Forum Gastein 2020 is Dancing with Elephants, New Partnerships for Health, Democracy and Business. Pick one elephant of your choice and tell me one challenge and one opportunity for the health sector to dance with it.
Okay, well, one challenge is definitely this issue of health democracy, the issue of addressing the current COVID crisis not only as a government, but really as a country, as a society, together with communities, together with the population, together with civil society, because it's really only that way that we're learning now. This challenge is surmountable. And so that's also an opportunity. It's an opportunity to strengthen those links where they exist. And unfortunately, in most places, what we're seeing, at least in the health sector, that those links don't really exist, or at least they're not, they're so weak so as to be almost non-existent. So this is the opportunity to build them and to recognize the importance of them, invest in them so that they can bear fruit, not only within this crisis, but also for the future.
During the COVID-19 response, civil society was mainly left out of the decision-making processes. If you had to point out one reason why this was so, which one would it be?
I think this sort of knee-jerk default reaction or default mode of governance that we've always been in, unfortunately, doesn't really include civil society. And I think that's at the core of why they were left out. Because what we do see is that in places where those links are a bit stronger, where there is, where governance has been traditionally somewhat more inclusive, then even in the crisis mode, those links and those relationships are then activated to be used in service of the crisis. So this is really why, why the governance overall of the health sector and of the public sector in general, because as we know that COVID crisis goes beyond health, has to change. And by doing so, by building up those mechanisms to dialogue and collaborate between government and with civil society, with populations directly, with citizens directly, with residents, with the communities, we are stronger together for the next crisis, but not only for the next crisis, but for health systems in general, for normal functioning of the health system. So it's an opportunity, and it also gets to the heart of why civil society was left out.
We're all embracing new technologies. The way we're recording this interview right now is one example of that. How can digital technologies facilitate participatory health governance? Give us one example.
Well, it's increasingly being used as a key tool to reach out to populations and communities, and indeed also civil society. We've seen that in 2018, France did a very broad scale consultation with the population for to prepare the revision of its bioethics law, which happens every 7 years. So, and they had a very big pillar on digital technologies. We see it everywhere. Digital technologies is the future, and I think it's an important pillar to have in efforts towards health democracy, efforts towards communicating with and dialoguing with and collaborating with people. On the other hand, we shouldn't see it as the only tool, and it offers a lot, but it also has its drawbacks. There are a lot of people that don't access to digital technology, that feel less familiar with it. We also know that all of those vulnerable groups who are most affected by COVID have less access to digital technologies and internet. So we shouldn't see it as the be all and end all. It's something that we need to embrace. We need to add it into our sort of palette of tools that we use to reach out to people, but it should be one of several, and we need to diversify, make sure that digital technologies are a key pillar, and it's a huge opportunity and can facilitate access to youth, to people who are just too busy and wouldn't have time otherwise to come to face-to-face events. So there's a huge opportunity, but we should see it as one complements existing approaches and not one that replaces them.